for your chair, and congratulations to my honourable friend, the member for Waveney, for securing today's important debate. I am all too well aware of the issues surrounding the availability of dentists in North Devon. I could not find an NHS dentist when I moved there in 2017 and continued to travel back to my previous dentist in Wiltshire for 18 months until I was lucky enough to find one. My first surgery on election in 2019 was with a dental nurse detailing the discrepancies between her terms and conditions and those of other nurses within our healthcare system, as well as the issues surrounding the contracts making NHS dentistry unattractive to a growing number of dentists. The lack of availability of dentists in North Devon significantly precedes the pandemic. The South West is particularly poorly served for dentists. When looking at hospital dental extractions for the 0 to 19-year-old group, the South West exceeds the England average of 0.4% at 0.5%. North Devon is double the England average at 0.8%, which is unacceptable. In Devon, just 36% of children have seen a dentist within the last year, and only 43% of adults, compared to 60% and 51% pre-pandemic. William Shakespeare noted in Much Ado About Nothing, "For there was never yet a philosopher that could endure the toothache patiently." And it's not just philosophers who cannot endure toothache patiently, and nor should we. My constituents write in their droves about their problems accessing dental services. Only this morning, a retired couple contacted me, having recently moved to my constituency. They cannot afford private dental treatment, and despite being my dentist patients in their former home, have been advised it is a 5-year wait for a place with the same company in North Devon. Another constituent wrote, "I moved to Devon in September 2018, transferring to an area where my skills were required. I'm an average wage earner, and in this time I have been on a waiting list for an NHS dentist. I now have a dental problem. I used an emergency service yesterday, paid the £23 to sit in the chair for a little over a minute to be told I need to find a dentist and have a crown fitted ASAP. The dentist kindly disposed of the chunk of tooth that had broken away. I can't even register with a private dentist, let alone an NHS one, and I have warned treatment will be £600 at least." And another, patients at Barnstable Dental Practices who have been there for 7 years, who've paid for private treatment ever since they moved there, but observed, "We never thought we would be in a situation where we would not have NHS treatment for our children." In August 21, they received 3 letters advising that there would be no further NHS treatment for children at the practice. A school holiday trip to the dentist was part of my childhood, and I find it deeply concerning that children in my North Devon constituency are unable to do the same. All too many children have never seen a dentist, and given the statistics I have already given about the need for hospital extractions for young people in North Devon, we are storing up even greater dental issues in the future. Surely it is possible for dentists to attend schools and check our youngsters' teeth. There has to be a way to directly facilitate this, and I do hope the Minister is looking into some innovative solutions and whether the 100 community diagnostic centres promised by her department will also house a dentist facility, as our oral health seems to have an associated backlog beyond the pandemic. During the lockdowns, I met with Dr Vinay Ranjia from my dentist, who had some suggestions on what more could be done to secure more dentists in the short term. And whilst warmly welcoming the additional training places for UK dentists, the time lag is far, far too long. We know the contract needs addressing, but the fundamental issue in my constituency is a lack of actual dentists. Suggestions that came forward as to really simplify the processes to enable internationally trained dentists to come and work in the UK. We should take advantage of Brexit, harness the power of the Commonwealth, and in particular the oversupply of dentists in India who are available to come and work in the UK. And I very much hope steps are being taken to work with our Indian friends and rebalance this dental supply inequality. The Minister and I have already exchanged much correspondence on this matter, and I know steps are underway, but I fear the magnitude of the problem in remote coastal communities like mine need bigger and bolder interventions. The 50 million is warmly welcomed, and since speaking to the Minister yesterday, I did go and talk to my CCG and check that steps were underway to make sure my local dentists were accessing it. And NHS England have written to all dental providers in the region, have gathered 51 expressions of interest, of which only 31 meet the criteria set. I'm not sure what's wrong with the other 20, but it does seem to raise more concern. In the South West, we also have retained our urgent dental hubs and do actually have an urgent dental care initiative providing an extra 1,100 appointments a week. And whilst this is warmly welcome, that's for the whole southwest of England, those 1,100, my inbox tells me this is not going to be anywhere near covering the demand in North Devon. Last summer, the Chief Medical Officer, Professor Chris Whitty, highlighted the health disparities in coastal communities compared to their inland neighbours, as it is not just positive dental health outcomes that are hard to come by in my North Devon constituency. I know the Minister is aware of the issues, but we need our children to be able to access dental checkups. As the social activist Geoffrey Canada observed, good dental care doesn't make you a good student, but if your tooth hurts, it's hard to be a good student. The depth of dental decay cannot wait. We need more dentists available to see us now.